Secretary of State, strikes across the NHS are self-evidently one of the major challenges facing the service at this time. What is your plan to end them?
Well, we firstly are engaging with the trade unions. I think if you look at the last meeting we had, the chair of the NHS Staff Council, Sarah Gordon, said that our discussion had been constructive, and that's very much the tenure in which we are engaging with trade union colleagues. We recognise that the NHS has been under huge pressure through the pandemic, and also the pressures that many others in society face from the cost of living also apply to those working within the NHS. So we recognise both in terms of the demand from COVID, the demand we saw over Christmas in terms of the huge spike in flu, over 100 times the number of people in hospital with flu compared to the same time last year. A very sudden spike in terms of a sevenfold increase in the space of a month going into December, on top of a high ongoing level of COVID that the system itself was under huge pressure. But also that comes in the wider economic context that society as a whole, given the cost of the pandemic, given the impact of inflation from the war in Ukraine, has also seen cost of living pressures, and NHS staff are all part of that. So we're engaging with trade union colleagues. I've had a series of meetings with them. We do have a process through the independent pay review body, which is one indeed opposition colleagues, certainly the Labour front bench, also support a independent pay review body process. We recognise, as you know, Chair, given the difficulties that we should accept in full the recommendations last year, which we did, in terms of last year's pay, that came on top of the 3% that was awarded to NHS staff at a time when the rest of the public sector had a pay freeze the year before. And we're keen to work with trade union colleagues and indeed have our discussions with them in the context of this coming year's pay review body to best reflect those ongoing pressures within the NHS that play through in retention issues for staff, which the committee may want to explore, and so that we can reflect inflation alongside the other Treasury equities, which other colleagues in government will want to reinforce in terms of the wider affordability of any pay deal, given the size of the NHS workforce.
It's very much looking to next year's round. But of course, as we heard this morning when Philippa Hurd was before us, they will report in the spring, in later in April, and that may move the dial on this industrial action. But of course, that's still 3 or 2 and a bit months away. So, should we expect any movement on industrial action between now and then?
We've got the process through the pay review body that is about looking at what's happened since last year. That's the very tenet of the evidence that government submits, that other representatives submit to the pay review body. Indeed, I think the witness evidence this morning was referencing the fact that there is evidence from a wild field, including some trade unions within that. In terms of our engagement, my evidence to them in February, that is still the timeline and the plan. I think one of the issues trade union colleagues have raised with me is often the length of time until the final decision is taken and how that can have an impact in terms of the backdating of the decision of the pay review body. So we're very keen to work with the trade unions to see how we ensure that the process is completed in an expedited way. I know the evidence in terms of the department, and this came up this morning, being submitted has been delayed slightly, but that's so we could take on board the representations of the trade unions and have those further discussions, not just within health, but across other departments as well. And that's been very much a cross-government initiative, which reflected the PM steer.
Treasury have submitted